Hello everyone. If ever you have faced difficulty in understanding ECG, here this video is for you to learn the basics for ECG interpretation. So before we go into the steps for ECG interpretation, let's discuss about the concepts that will help us in better understanding about the processes going on inside the heart as it generates a heartbeat. Among this, the first and foremost concept to be understood is the conduction system of the heart. The conduction system of the heart includes the following. First is the SA node or the sinoatrial node. As the name indicates, it is present on the right atrium of the heart. SA node is also known as the natural pacemaker of the heart because this is where the conduction begins. From the SA node, the conduction goes to the AV node or the atrioventricular node. Again, as the name indicates, this is present in the border of right atrium and right ventricle. AV node is otherwise called the gatekeeper of the heart as it gets to decide what impulse to let through. So if the SA node generates a weak impulse or if there is any block somewhere near, then AV node decides not to let the impulse go through and instead it conducts its own impulse. From AV node, it goes to the bundle of His and it continues and bifurcates into the right and left bundle branches. From the right and left branches, it extends up to the apex of the heart and is called the Purkinje fibers. So to conclude, the conduction starts from the SA node to the AV node to the bundle of His to the right and left bundle branches and eventually ends at the Purkinje fibers. Now, as we have gone through the conduction system of the heart, let's move into the next concept, which is the inherent rate. If the impulse is generated from the SA node and is conducted all the way to the Purkinje fibers, then it generates a heart rate of about 60 to 100 beats per minute. However, for some reason, if SA node fails or if there is a block somewhere near, then AV node generates its own impulse, and when this happens, the heart rate will be 40 to 60 beats per minute. And same is the case with bundle of His. If the AV node as well as bundle of His fails, the right and left bundle branches and the Purkinje fibers generates the impulse, which gives a heart rate of about 20 to 40 beats per minute. Now let's move on to ECG interpretation. First of all, let's discuss the different parts of an ECG. We have a small bump at the beginning, which is the P wave, and next is a tall structure, which is the QRS complex, and the last bump is the T wave. Let's discuss in detail. The P wave indicates atrial depolarization, where the two atria contract. The QRS complex represents ventricular depolarization, where the ventricles contract. Lastly, we have the T wave, which represents ventricular repolarization, where the ventricles relax. So remember, repolarization, relaxation. So every depolarization is followed by a repolarization. That is, every contraction is followed by a relaxation. Now a question arises, where is atrial repolarization? As you can see, the QRS complex is a tall structure. So from this we can interpret that the contraction of the ventricles is stronger than the atria, so it tends to mask the atrial repolarization. Hence, atrial repolarization can be found after the P wave within the QRS complex. So let's sum up. We have P wave representing atrial depolarization, the QRS complex representing the ventricular depolarization, the T wave representing the ventricular repolarization, and the atrial repolarization, we have it within the QRS complex. Now let's move on to the segments and intervals of an ECG diagram. We have 5 of them, which are the PR interval, PR segment, QRS complex, ST segment, and the QT interval. Among them, the PR interval and the QRS complex are usually used for easy interpretation of ECG. So we have a typical ECG strip here. So in an ECG strip, we have a big box with 5 small boxes in it. Each small box is 0.04 seconds, and therefore, so one big box is 0.20 second. Now let's go step by step. First and foremost, we should identify and examine the P wave. So we have the P wave here. It is present and upright. Next, we have to measure the PR interval. PR interval is the distance between the beginning of the P wave and the QRS complex. Now, count the number of small boxes within the distance and multiply it by 0.04. We'll get the PR interval. The normal value ranges from 0.12 to 0.20 seconds. Anything greater than 0.20 second indicates dysrhythmia, etc. The next step would be to measure the QRS complex. Just like before, we have to count the number of small boxes between the QRS complex and multiply the number by 0.04. The normal value is 0.06 to 0.12 seconds. Now let's look into the heart rhythm. So a rhythm is either regular or irregular. How do we measure this? Let's see. Check the distance between the R's. If the distance is same, then it's regular, otherwise it's irregular. Moving on, let's calculate the heart rate. If our ECG strip is a 6-second strip, we can see 3 lines above this strip. The first line up to the third line gives 6 seconds. Now, count the number of R's in between these lines and multiply that number by 10. So we'll get the heart rate. If it is not a 6-second strip, then we have to count the big boxes in between the 2 R's and divide 300 by that number. This works only for a regular rhythm, whereas the 6-second strip method works for irregular rhythm too. So that's it. This is all you need to have a basic idea about ECG. Once you are ready with these normal findings, you can easily find out the abnormalities in an ECG. Thank you.